A 6-month-old boy with gastrointestinal bleeding and abdominal pain. Gastrointestinal bleeding is a symptom of a disorder in your digestive tract. It's when bleeding occurs in any part of the gastrointestinal tract, which may be caused by several things. Abdominal pain is the pain that you feel anywhere between your groin and chest.
So abdominal pain is a very broad topic because we have organs in our abdominal cavity and all of them can have different types of pain and different locations of pain. So when you talk to your doctor about saying that you have pain, it's important to talk about the character, if it's a sharp pain or a dull pain or
Neonatal gastrointestinal bleeding. Blood in the stool in the neonatal period is a common problem with a variety of causes that range from benign to life-threatening. Applications in medicine. The knowledge of gastrointestinal bleeding is extremely necessary in order to give the right treatment and ease abdominal pain in neonates. Knowing if the bleeding is coming from the upper or lower digestive tract can help your diagnosis.
Hello, this is Dr. Carlo Ojet, emergency physician and founder of edxavideo.com. This video is about gastrointestinal bleeding. The first thing we need to do is make the differentiation between upper gastrointestinal bleeding and lower gastrointestinal bleeding. If you're vomiting blood, that is called hematemesis. And hematemesis can be due to a Malloy-Weiss stare. If you want to learn more about that specifically, I have a video just on that. But it's usually the result of forceful vomiting that causes a tiny tear at the junction of the stomach and the esophagus. It's usually self-limited and it heals itself in 2 or 3 days. It's not severe, it happens in young people, and it really doesn't pose any major bad outcomes. But it can also be due to a more deep tear or the esophagus. It can be due to ulcer, it can be due to severe gastritis, and upper, like cancer in the stomach, and so on. So, for people with other disorders, persistent upper vomiting through the gastrointestinal tract, then patients usually need an endoscopy, a tube down the throat, into esophagus and into the stomach to see the bleeding and perhaps make it stop. Of course, if you're tachycardic, hypotensive, if you have a low blood count, then you're more likely to need a blood transfusion, more aggressive management. If your vitals are normal, you only vomited blood once, you're very likely to go home. If the bleeding is from below, from the rectum, then it can be many different things. First, it could be a massive upper gastrointestinal bleed because blood is cathartic. It makes diarrhea, so the bowels move really fast and the blood still comes out red or maroon colored, as we call it. If this is the case, you probably will have systemic symptoms and it will be treated by admission, IV medications, possible transfusions, and an emergent endoscopy. Bright red blood per rectum without any pain is usually benign disease. It's either an internal hemorrhoid, internal polyp, but usually diverticular disease, especially if you're older. See, most people in the United States have diverticulum, which are tiny pockets in the distal sigmoid colon. And these can bleed from time to time. But if you're older and you have this massive type of lower GI bleed, it probably needs a sigmoidoscopy and something to make the bleeding stop. It can also be due to polyps, AVMs, which is arteriovenous malformations. It can be due to an external hemorrhoid, but usually the pain from external hemorrhoid is very severe, very sharp, and you can feel a lump in the rectal area when you're palpating. So that covers more of the common causes of gastrointestinal bleeding. If you think you have one of those, I probably already have a video or a link in my website to one of the videos that explains each kind of individual type of bleeding. For example, external hemorrhoids, internal hemorrhoids versus diverticulosis and diverticular bleeds, and so on. I hope you find this useful, and God bless.
Pros and cons. Pros, they are common diseases, so it's known the treatment. There are many treatments for these diseases which can be pharmaceutical or non-pharmaceutical. Cons, if the bleeding is left unattended or it takes too long to start treatment, it could be fatal. To diagnose the origin of the bleeding, it is used an endoscopy or colonoscopy, which may be discomfortable for the infant. Issue applied in Ecuador. Gastrointestinal bleeding and abdominal pain are diseases common worldwide. In Ecuador, the incidence of this symptom is much higher in males than females. In the pediatric ICU population, 6 to 20% of the patients has upper gastrointestinal bleeding. Conclusion. In conclusion, gastrointestinal bleeding and abdominal pain are worldwide symptoms which origin may vary depending the source of the affected area. Also, they are very often in the population, so it's important to know how to treat them.